Assalamu alaikum. Welcome to Dermatology Journal Scan of July 2026. Starting with psoriasis, Hagino et al. Followed 132 patients with psoriasis of special sites treated with deucravacitinib for 2 years. Their findings established the efficacy and safety of this small molecule in treating genital and scalp psoriasis with less than optimal response for nail psoriasis. The adverse events over this 2-year period were mild and mainly in the form of upper respiratory tract infections. Obesity and diabetes are exacerbating factors for both psoriasis and psoriatic arthritis. Feng et al. Raised the question whether psoriasis patients without arthritis receiving glucagon-like peptide 1 receptor agonists are at less risk of developing psoriatic arthritis. Their findings confirm the protective effect of glucagon-like peptide 1 receptor agonist on psoriatic arthritis development with a health risk of 0.57 at 1 year and 0.74 at 10 years in comparison to cutaneous psoriasis patients not receiving this type of treatment. With the emergence of fungal resistance and the overuse of antifungals, Zhang et al. Reminds us in this article about antifungal hepatotoxicity in patients with chronic liver disease. As you recall, ketoconazole has been banned by the European Medical Association and restricted by the FDA because of its hepatotoxic effects. Unsurprisingly, voriconazole carried the highest risk of hepatotoxicity in patients with chronic liver disease with a risk ratio of 3.78, which is almost the same as the risk ratio of 4 associated with ketoconazole use. On the other hand, terbinafine carried the least risk of liver injury. Cox et al. Presented a review about the rise of antifungal resistant trichophyton indutini infection. The first line of therapy for trichophyton indutini remains itraconazole, but in a higher dose and an extended period of time. Terbinafine also is recommended in higher and prolonged dosing, but failures is common, while fluconazole and grazophulvine seems to be weaker in treating this new resistance strain. Because of its potential side effects, voriconazole, although superior to other antifungals for the resistant trichophyton indutini, its routine use is discouraged, and also equally important to avoid emergence and spread of drug-resistant fungi. For post-inflammatory acne hyperpigmentation, this article in the American Journal of Clinical Dermatology ascertains the importance of using sunscreens for these patients and the addition of topical vitamin C and nicotinamide as they may help in the hyperpigmentation. All other widely used modalities for post-acne hyperpigmentation are categorized according to the severity of the hyperpigmentation. A real-world data about outcomes of using JAK inhibitors for treating chronic urticaria are published in the Journal of the American Academy of Dermatology this month. Abrocitinib and upadacitinib were used in 14 chronic spontaneous urticaria and 2 chronic inducible urticaria patients who failed antihistamines and omalizumab. 78.6% of patients with chronic spontaneous urticaria improved with JAK inhibitors. Complete response was observed in 36.4% and 21% of patients did not show any improvement with JAK inhibitors. Interestingly, no further improvement in the urticaria occurred after the week 8 or 12, and relapse was almost 20% on stopping or even dose reduction of the JAK inhibitors. For the 2 patients with chronic inducible urticaria, symptomatic dermographism showed partial response to JAK inhibitors, while cholinergic urticaria did not respond at all. Patil et al. Published a very useful study in the JAMA examining the effect of megadose of oral vitamin D in the management of toxic erythema of chemotherapy and in acute radiation dermatitis. The rapid and beneficial effects of vitamin D was evident in the results and is recommended to use this regimen considering the minimal side effects associated with vitamin D treatment. Finally, in the British Journal of Dermatology, Lee et al. Presents novel findings of how mechanical stress and interferon gamma may exacerbate vitiligo through upregulation of a cathepsin L. Cathepsin L in the skin is produced by keratinocytes, fibroblasts, and hair follicles. Cathepsin in general are proteolytic enzymes with the L subtype acting as a cleaver that disrupts adhesion molecules, namely focal adhesion kinase and integrin beta 1. Loss of these adhesion molecules in the skin lead to melanocyte detachment and deaths. Interestingly, one of the mechanisms of action of baricitinib is demonstrated to be through downregulation of cathepsin L and thus protecting adhesion molecules of the melanocytes.